Hello everyone, I'm Dr. Shilpi Bhadani. I'm a board certified plastic surgeon and I practice at SB Aesthetics, Gurugram, India. Before you go ahead and watch this video, do click the subscribe button because we keep posting very interesting information about plastic surgery, maxillofacial surgery and skincare in general. So this would be a really useful resource for you. Now, we will discuss in this video about hip dips. You must have heard this term very commonly. And are they normal or are they abnormal? Should you go to great lengths to really correct it? And what about body positivity? Should you accept it as it is? So let us unravel all these secrets for you in this video. Now, if you identify yourself as someone who is having hip dips, then you can comment hip dips in the comment box below and we'll send you very important information about these hip dips. Now let's go ahead and understand what are these hip dips. Hip dips are depressions under the iliac bone. So this is on the side, and this is also a very common misconception, that people think that hips are really this area, the curvature around the back. No, those are the butts. And on the sides, you have the hips. So the hips are the side curvature of your body. And usually in females, it starts from the iliac crest, which is above, and then it comes outwards, and then again, it again goes in around the thighs. So this should naturally be a seamless curve, but anatomical variation is absolutely normal, and women will have a very curvaceous body or may have something which is much leaner. Both are absolutely normal. But sometimes these hip dips, they bother people and they want to correct it. And I'm not talking only about women over here. Sometimes males also want to correct their extreme hip dips because their clothes do not fit them well. So these are basically trochanteric depressions, and sometimes they can be not only due to loss of fat or less fat over there, but they can be a part of your bony structure, your muscle or thin skin. So there can be varied amount of reasons why you will have a prominent hip dip. What are the ways to correct the hip dip? The simple and the straightforward answer is fat grafting. Fat grafting is really a very valuable tool with which we correct these hip dips. It may take more than one session, but sometimes we can achieve a great correction even in one session. This is an area of a very strong adhesion. So basically the skin is quite adherent to the fascia underneath, and that is why some people will have a very prominent hip dip. I had a patient who actually complained that while she was lying on the side, she used to feel very uncomfortable because she had no padding of fat between the skin and the muscle, and that is why she wanted to get it corrected. And for many others, it may be purely cosmetic that they want to correct the hip dips. Whatever your reason may be, but yes, fat grafting is a tool which can help you immensely. We take out fat from another part of body and we inject it into these areas, and it can help in giving that necessary padding that is required over there, also giving you a better contour. Now let me tell you that there are also hip implants, and they can be introduced by a small cut underneath the iliac bone. We can make a pocket and slide that implant inside. So this will give you correction in one go, and you need not go for repeat sessions like we do in fat grafting. If your skin is accommodating enough, even one session of fat grafting is good enough. Now what if you don't want surgery, you don't want implant? Is there a solution? Yes, fillers are your solution, but it is hyaluronic acid and it will go down with time. So you have to make peace with understanding that you have to get it done every now and then because your body will naturally absorb the hyaluronic acid. So these are the three important ways in which we can correct hip dips: fat transfer, implants and fillers. Also, let me tell you that when we are doing a BBL surgery or a Brazilian butt lift surgery where we are augmenting the volume of the butt, we also do graft the fat into the hips and somewhat on the anterior thighs also, because we are wanting to give you a seamless contour from your waist downwards until your hips. So yes, hip dips are normal. So this was about hip dips from my side. I can also tell you that there are some patients who undergo hip surgery, and due to the scar over there, the fat gets atrophied, and in them also fat transfer is a good option. So if you want to know more about the procedure and you want to know how fat grafting happens and how we can achieve a good contour, I have many videos on fat grafting on our channel. We'll put some links in the description box below for your advantage, and do like the video and share it with your friends, and thank you for watching.